Welcome to my Period Stories, a menstrual health podcast where we talk about periods, period challenges, the business of menstrual health and policies surrounding it. Most importantly, we curate period stories from across Africa and indeed the rest of the world. I'm your host, Funke Treasure. I have Dr. Abayomi Ajayi with us today, and no, he's not talking endometriosis today. You're going to be listening to something markedly different. Fingers crossed, after the break. Fibroids are non-cancerous tumors that grow in and around the muscular wall of the uterus. They're the most common tumors found around the female reproductive organs. Some women are lucky. They aren't aware they have fibroids. Some know that they have fibroids and it affects them. Some, they have to do something about it when it becomes life-threatening. When it is, it has to be taken out. Sometimes it's a mammectomy. Sometimes it's a hysterectomy. These are the common procedures we know. But there is the non-invasive procedure, and that's what Dr. Ajayi is here to talk about. Does he need introduction? Okay, let's do some. Dr. Abayomi Ajayi is an obstetrician gynecologist. He is the managing director of Nordica Fertility Center in Lagos. They pioneered IMSI in Nigeria and IVF and treating infertility. Is Nigeria's representative of Obgyn.net, a network of obstetricians and gynecologists from all over the world. Dr. Ajayi has international memberships of many international professions across the world, including the Global Health Council. We need an applause for him. He's our guest. He's been our guest before on endometriosis in our season 1, but he's here again today to talk about non-invasive procedure for fibroids. My pleasure. Dr. Ajayi, to have you a second time.
Thank you so very much.
I am going to be the lone clapper.
Let me join you.
Thank you so much. Busy you. It's been a thrill, doing this with you. First season with you. Second season, here you are again. Thank you for the time.
My pleasure.
Thank you for your service
Thank
to
you for
humanity.
what you are doing too.
Thank you. Thank you, doctor. Non-invasive surgery, procedure. You corrected me. What is this about? What we know is that you just enter, let them take whatever it is out, you go on with your life. What is this non-invasive procedure?
Okay, let's flip back a little bit and say a few years ago that we hear a lot of gory stories about fibroids. And I started thinking that there must be a better way, a much easier way to treat fibroids.
Right.
And so, fortunately, I made this procedure about 8-10 years ago, but it was just developing then. It was in America, then finally it got to China, and then about 4 years ago, I saw the procedure again. And this time I knew that it was time for us to bring it to Nigeria. So 3 years ago, we opened the first fibroid care center in Lagos. Now, this procedure is ridiculously simple, and this is what I mean. We don't cut you. We don't send you to sleep. It's as simple as you just lying down on a couch. And then, because it's what we do is that HIFU is the name of the process, which is high-intensity focused ultrasound. So in other words, what we're using actually is ultrasound. Okay. Now, these ultrasound rays are now focused at a particular point, and then the energy, the heat in that at that point, once it can exceed about 62 degrees centigrade, it destroys the tissue. It's simply like you have an egg. Okay. If it is a raw egg, you can break it, you can fry, you can do anything you like with it. But if the same egg, if I subject it to this heat, then you cannot break it anymore. You can't fry it anymore because the protein in the egg has been changed. So we call it's been denatured. Okay. And that's the same thing that happens to the fibroids. So this heat now denatures the fibroid, but it's so great in that it doesn't even affect the surrounding tissue. So because the focus is on the fibroid. All right. So if you have as many fibroids as possible, you can just take them one at a time. The good thing what the machine does is that it slices these fibroids actually into slices, and you can then burn them one at a time. Okay. And then, so it takes about 2 hours, 2.5 hours, depends on how fast the operator is. But it's a completely safe process. You don't need blood transfusion, you don't. And those are why did people start thinking about non-invasive methods of treating fibroids? Because we know that the invasive methods are, the uterus is naturally a bloody organ. Okay. When you are not pregnant, about the blood supply to the uterus is about 10 mils per minute. Okay. But when you are pregnant, it becomes about 600 mils per minute. Okay. So the uterus on itself is a very bloody organ. And therefore, we call it vascular, but it's a bloody organ, right, so that everybody can understand what I mean. So, if anything that affects the blood supply, if you cut the blood supply, and then for any reason, either the suture slips off, then you can imagine you can bleed the whole blood volume into your abdomen. So, and those are some of the problems that we have during the time that the doctor is trying to bring out the fibroids. For example, in Nigeria, you see women with about 10, sometimes 15, 20 seedlings, and the doctor has to go through all that. Okay. So in the process, sometimes the suture that he has done, that he has used to maintain what we call hemostasis, that the blood is no longer bleeding, slips.
Okay, doctor, I'm not sure that I'm absorbing all that you're saying anymore, because the more you talk, the more I'm imagining somebody just lying down there without any cut at all. And there's a procedure going on. And she goes home without, like nobody's going to cut you.
Nope.
And you're just going to stay there. And as you said, there's a slice. And
which you don't see. It's
the
software that says that. So if the doctor sits, it's like the cockpit of an aircraft. I wish you could come. So the doctor can see the fibroid, because before the process or the MRI will have been done, magnetic resonance imaging, and therefore the doctor can put the image there. It maps where the fibroid is exactly in the uterus, okay, and he can see it on the screen, and that is what is actually treating. What the patient can feel probably is because of the fact that the ultrasound waves is being converted to heat energy.
She's not going to be anesthetized.
No form of anesthesia at all. But she's just sedated so that she can just relax. Okay. But, because she's going to lie in water, because, ultrasound travels in water. Okay. That's why you are told to have a full bladder if you want to do ultrasound. So she's going to lie in water. The water might become warm or even hot over time. That's why we don't even make her sleep, so that she can tell us when the heat in the water is becoming unbearable. She can tell us when she's having, for example, because sometimes you're hitting on a fibroid that is very near a nerve, okay, and she starts having the pain because of the scatter of the energy, of the heat energy. So she can tell us also when she has pain in her legs, okay, because at that point in time we stop and then reevaluate to give it some time, and we start delivering in a different direction.
Dr. Ajayi, hold on. So, some of these fibroid tumors can be really tiny, which is why they regrow when the mammectomy is done. So this non-invasive procedure, would it take all these minutest ones into consideration?
It cannot take anything that is we will not look for anything that's let's say, less than 2 cm, okay? Because that's not likely to be problematic, except if she does not have many fibroids. Imagine you have about 20, and one is 10 cm, one is 12 cm. It's those big ones that will shoot that for. But because there is also backscatter of heat, just like backscatter of heat.
What does backscatter mean?
It's like a ray.
A ray of light?
Yeah. There is backscatter, because when a ray of light hits anything, So it
Like
goes
a
to where-
diffusion,
exactly.
yes.
So
Okay.
some of these areas around the fibroid also can get a little bit heated from there. Okay, so that can take care of those small ones. Okay, but we're not going to be focusing on them per se. All right, because what I said is that once the temperature around the fibroid hits about 60 degrees centigrade, it becomes denatured, and so it dies.
The
fibroid
word is
dies.
denatured.
Yes, so it dies.
Would it grow again or never to grow again because of the heat?
Once something dies, I mean, this is what we do.
Okay, so I'm using the old knowledge of myomectomy
That is
to try and understand what you're saying.
problem that we have. People are marrying, they're putting new wine in old wineskin. Okay.
Forgive
so
me,
no, but that's
how I
we
can
are.
try to understand it.
Yeah, I get it. That's what we face also. That so one of the questions they ask us is, okay, you said the fibroid has been killed. Where is it going to go? Okay.
So because if you're not taking them out,
Exactly.
where are they?
Where is it going to go? But what happens is that anything that dies in the body takes care of it. So the fibroids start shrinking, and that is what we monitor to see as success. The first thing the doctor wants to do, he wants to burn at least about 75% of the fibroid. Once he can ensure that he has burnt about 75% of the fibroid, and they are dead, you can be sure that the fibroid will die. Okay. All right. Will die completely. So it starts shrinking over time, and that's what we monitor. Okay. So we look at, after 3 months, after 6 months, after 9 months, after 1 year, how far it has shrunken.
So the patient is constantly under observation?
Not really. Monitoring is
monitoring,
the better word.
yes, monitoring.
Yeah, because we don't observe them. You just two hours after the procedure, you're good to go home. Okay, yeah. By the evening, you've started taking some things. By the next day, you can eat anything.
Look, doctor, wait. So this idea of don't take banana, don't take this, don't take that one is told after a myomectomy does not occur with this one.
No,
you can just start eating yam and...
Oh, yeah, by the next day you are free to eat yam if you like.
Really?
Yeah.
Sounds too good to be true.
That's the thing about technology. It makes our lives easier. But there's some things you need to have done before we do the process. Okay.
All right. Let me pause you. Let's go on this break. When we come back, there are some things that need to have been done. We'll start from there. You're still watching My Period Stories with me, Funke Treasure. And we're talking fighting fibroids, the non-invasive way. And Dr. Abayomi Ajayi has been telling us a lot about this non-invasive procedure. If you're like me with jaw dropping, I'm sure you can't wait for us to return to this conversation. So back to you, Dr. Ajayi. If we know about myomectomy and hysterectomy, how come this non-invasive procedure that you're talking about is not common yet?
Great question.
It's so simple, but it's not common.
Yeah, great question, because to start with, it's relatively new. Okay, but that new, if I say, in some countries, it's they've used it for 10. In fact, in South Africa, they've used it for about 10 years.
That's
10
so
years.
way ahead of us here in Nigeria.
Okay, and then the machine is a little bit pricey. So, so maybe that's one of the things. But for me, I see the advantages really outweigh the monetary aspect of things.
Yeah, because I was going to ask, if the machines are pricey to acquire, then does it mean that this procedure also would be a little not affordable?
Well, I don't know about affordable, because we've
Dr.
done
Ajayi,
over 500. No, we've done over 500 here in Lagos, and we've just started in Abuja. Done about 10 in Abuja now. So it's
catching on.
It's really catching up. So I guess it's a matter of priority. It's a matter of everything. There's so many things indices that I see in Nigeria, I think for a very long time we've taken our health care for granted, and maybe free health, whatever. There's some things that have really guided how we think. But when something is new, you have to make up your mind. Is this something we want to go into or something? What I'm saying is that we have done over 500 patients. We don't have anybody admitted as a result of the procedure.
So there is no after effects?
We have
One should not be afraid of any?
No, there can be after effects.
Okay,
the training of the doctor, of the people doing it, is very, very important. So it's not just buying the machine and putting it down. The doctors must be very well trained, and then it becomes very safe.
Okay, but what if there's a problem? You've told us that you just sit there, you need water, you finish, you go home, there's monitoring. Mm-hmm. What are the likely complications?
Okay, the likely complications, the commonest is that there can be skin burns. That, like I said,
because of the heat.
Because of the heat. And that's when the patient is conscious, she can tell you if it's getting too hot. Okay. The other thing is that there can be damage to the bowel if she's not prepared. That's why I said there's some things you need to do before that day. Okay, so just like you do if you have ever done the procedure they call colonoscopy, where you have to make sure that your bowel is empty before you do it. There are standard ways of making sure this happens. So we do bowel preparation for the patients so that we can be sure that, because we know that gas is also a bad conductor of ultrasound. Water is a very good conductor. Gas is so you need to the bowel preparation need to have been done. Once that has been done, the doctor is trained. They can almost anything, no problem will come out of it. But I guess the most important thing will be the cooperation of patient doing the right thing and the doctor being well trained. And with that, you can. Yeah,
500 people already in Lagos is quite a high number of women, but compared to the population of women who suffer from fibroids, that's still like a
it's
drop.
Just a pinch.
Yes.
Yeah.
So how can this be more affordable? You have cleverly avoided talking about the cost of it, but how can it be made more affordable, given that it's so simple? It should be democratized. Let me use that word.
Well, if it's going to happen like that way, then the government has to be involved. Okay. For those of us who are private practitioners, who have taken loan from these, we have to be able to recoup over a long period of time what we have invested. So, but you see, when we pay too much attention on money, I get concerned. Because one woman's life, to me, is more important than the money that we keep talking about.
Yeah, but what if people can't afford it? The cost of living is quite high.
If people have done over 500 and you tell me people cannot afford it.
Doctor, what if you have the elites patronizing you?
No, I don't think so. Don't forget that when we talk about the elites, even as Nigeria is now, some people are still going abroad for headache.
Because they can afford it.
Exactly. So the elites, most of the time, probably, where a few people are beginning to believe in Nigeria now. Okay. But we hope that many more, because we are now providing, some of us are providing the kind of things that you will get anywhere in the world. And that's and there's so many people now trying to do that in Nigeria. I guess over time, the cycle is going to turn, and many more people are going to.
One critical question, Doctor. After this non-invasive procedure, how long can the woman wait before conception happens?
Wonderful question. Now, when we first started, because I'm in a family of people who do this HIFU,
I reckon.
And they were scattered all over the world. Okay. In Nigeria was a third to embrace in Africa. South Africa, Egypt, and then Nigeria was third. Now Tanzania has joined. But there's so many places, especially in Asia, Singapore, South Korea, there's so many machines in all those places, not to talk of China, of course. So, what we're seeing is that this is going to spread further. I expect that in Nigeria, after a few years now or months, some other people are also going to get this because, like we said, it's ridiculously easy. But of course, the problem usually, especially the more we devalue our naira, the more difficult it is to get some of these state-of-the-art equipment, and then for us to be able to recoup whatever. Except, like I said, government really wants to come into it.
Okay, but back to this, how long does it take for conception?
Oh, yes, thank you. I was trying to remember what.
Yeah,
it takes about, we started with 6 months, okay. But now, after 3 months, because the treatment is so specific, it does not damage the endometrium, the myometrium, that is the muscle of the uterus surrounding the fibroid. It specifically kills the fibroid. So, and you can have vaginal delivery after. You don't have to have a cesarean section. So,
really?
3 months after, 3 months after you can get pregnant. We have some people who didn't even wait for 3 months. I mean, what I tell people is that, okay, you say, I can get pregnant after 3 months because you want to have a check. What about if I'm pregnant before 3 months? You're not going to. We want you to wait for 3 months. But if you get pregnant before 3 months, we're not going to.
And it won't affect anything. There are no consequences.
Even in Nigeria, we've had people who have been pregnant before the 3 months follow-up.
Amazing.
So it's a very safe process. It's a very safe process.
This is one period story that is totally amazing to even me, because I'm still trying to wrap my head around the fact that you don't have any cuts anywhere. Nothing is being taken out of you. You can go ahead and eat whatever you like.
You can go ahead and get pregnant.
And then you get pregnant. In 3 months or less than 3 months.
Yeah.
Because it sounds too good to be true.
Because this time it is true. And we have so many studies, so many figures to show the safety of this procedure.
Talk to us about the figures.
But it is not for everyone.
How?
It is not for every fibroid. That's why I said before you do it, there's some things you need to have
evaluation.
Done.
Okay.
Yeah, some evaluation, exactly. It's not for everyone. And that's what we go through. Part of the training is to be able to identify the people who can benefit from the procedure. Okay. Now, we say there are relative contraindications and there are absolute contraindications to HIFU. Okay. The relative one will be if you are grossly obese. Okay. Because the ray of the ultrasound
and the fats
might not be able to get to, for example, if the fibroid is in the posterior part. But that's a relative contraindication. It's not an absolute contraindication. For people who have relative contraindication, we do what we call a simulation for them. That is, we're testing whether the treatment can take place. Okay. And if we see that it can take place, we still take them on. Okay. People who have had a liposuction might also have some problem. Okay.
Yeah, for the benefit of those who are not as literate as you and me, what is liposuction?
People who do cosmetic surgery and do tummy tuck.
There you go.
So sometimes we might have to do a simulation for them.
What does that mean?
I just said it, that we test as if we do the treatment.
Okay, or
and
not.
if it's okay, we go on to do the treatment. Okay. So those are some of the people that we might not just say, okay, come. Then if your fibroid also depends on the positioning of the fibroid. Yeah, we talk about where the fibroid is, and that's why you must do an MRI before we know whether you can do this procedure or not. Whether we need to even combine, if you do the HIFU, whether, for example, we don't want to bond anything where the baby should be, what we call the endometrium, the inner lining of the uterus.
That hollow where the baby grows.
Yes, because that's why even after surgery, some women will say, I've stopped seeing my menses after doing myomectomy. That is because the endometrium was hot during that procedure. So we don't want to burn anything in the endometrium. Okay. So for people who have fibroids, and some of them are in the endometrium, when we do HIFU, we still want to do what we call hysteroscopy, because that is the best way to get rid of any fibroid that is in the endometrium, even if you do open surgery. If your doctor is a good doctor, he's going to tell you to come and do hysteroscopy after the open surgery because it won't want to cut into the endometrial cavity. Okay. So we can also, when you do your MRI, we can see where the fibroids are. So we can advise even before you do the procedure whether, okay, you will need hysteroscopy. For people who are going to do IVF after, we always insist that they should do hysteroscopy because it's not when you have done HIFU, you have now done a cycle of IVF that they now see that, oh, no, there's something where the baby should be. We don't want to take that chance.
Right.
We tell you up front to do the hysteroscopy after your HIFU experience.
So this makes it way easier for those who also want to do IVF right after this procedure. I see that you also call it HIFU. What does that mean?
High intensity focused ultrasound.
Oh, that's it. Okay, so HIFU, non-invasive procedure for fibroid. That's it.
It's a wonderful method of treating.
What a show it has been today. We've had with us Dr. Abayomi Ajayi, an obstetrician gynecologist and the MD of Nautical Fertility Center in Lagos.
And the Fibroid Care Center.
And the Fibroid, so there's Nautical Fertility Center,
Now
and there
there's
is
a
the
Fibroid
Care
Care
Center. I must thank you for the wealth of knowledge you've shared with us all today. Thank you so much for your time. Thank you for supporting us on World Menstrual Hygiene Day as well. We visited the school for the deaf in Ibadan, and the children were really very happy. The teachers were happy as well. Nautical Fertility Center supported the SPMC's pad scholarship with reusable pads, detergents, beverages, pegs, underwear, and bags for the girls. I thank you very much. We bring you greetings from the Ibadan School for the Deaf. Thank you so much.
Thank you for what you're doing too.
Thank you. And that's it on the show today. Until we meet again, I'm Funke Treasure, asking you to live your life to the fullest and never keep quiet when you need help. Let's do this again next week. Bye-bye now.